everyone. Welcome back. I'm really excited to introduce Shelby VanCleve to you today. She's an acupuncturist and a holistic fertility specialist. Shelby empowers and supports women on their fertility journey, a topic that's close to my heart. Shelby, welcome to the show. Thank you very much for joining. I just want you to jump right in. Tell us a little bit about yourself, what you do, and why you do it.
Sure, I'd love to. So I'm an acupuncturist and I've been in clinical practice since 2009. Just a couple years into practice, I was just getting a influx of women that were struggling to get pregnant. And I decided that I needed to figure out how to help these women and hold space with them and walk with them. And so beginning around 2014, I started to delve into holistic fertility and got certified by the ABORM, which is an international certifying body for those of us that practice East Asian medicine that want to specialize in reproductive health. And so I sat for certification in 2017 and then furthermore went into functional medicine training for women's health with Dr. Aviva Ram in 2020. And so, beyond just acupuncture, I've just taken a deep dive into supporting women's health on many levels over the past over 15 years of practice.
Thank you for sharing that, Shelby. An immediate question that popped into my mind is, you were saying that you have people walking through the door, women walking through the door who are struggling to fall pregnant. And I don't know if it's because it's just maybe talked about more or because of the age group I'm now in, but I'm hearing that a lot. I myself was one of those women. And do we think that this is something that's occurring more frequently that women are struggling to fall pregnant? Or is it, like I said, just spoken about more?
Well, that's a curious question, but I do think that there's multiple factors involved. First of all, a lot of women are delaying pregnancy because they're going to school for longer periods of time and then pursuing a career. And so they're attempting to get pregnant at a time when their fertility is declining. In addition to that, a lot of women are put on birth control from a young age. They'll go and they'll have heavy periods or they'll have irregular cycles. And instead of addressing those conditions, they're put on birth control. And so when they come off of the birth control and they want to fall pregnant, they still have to deal with those issues that were there all along. And the third factor is, in our modern industrialized society, we're exposed to a lot of things that historically we were not exposed to: endocrine disrupting chemicals, pollutants, terrible food. And all of those things are impacting our overall health and as well as the health of our ovarian and testicle tissues.
And I'm happy that you just mentioned about testicle issues there at the end, only because I wanted to ask you, are you only seeing women? Are you treating men as well? Can you share a little bit about that?
I treat primarily women because that's primarily who walks through the door, and I do treat their partners by proxy. I do feel like there is more shame in the male population and in regards to infertility, where women tend to be a little bit more proactive. In addition, in most fertility clinics, the woman is the patient no matter what the diagnosis is. And the truth of the matter is treatments like IUI and IVF are technically treatments for male factor. They don't treat female infertility at all. Drugs like Clomid or Letrozole that are ovulation induction medications, those can treat ovulatory disorders in women. But when you're going and doing sperm washes and then injecting the sperm into the egg, that's a male factor treatment. But again, the patient is always the woman. And so they are the ones that show up in my office. But you better believe, Amy, I'm going to hold that boy responsible and he has to do his job, even if he doesn't show up in my office to get my tasks.
It's interesting, isn't it? And quite frustrating that it really does fall on the shoulders of the woman to fix her health, to make all these lifestyle changes, which are beneficial in many cases. But you're right, it's the woman who walks through the door, and I see it, in my Reiki practice. Again, I went through IVF, and I was the one who initiated all that. I was the one going and seeing, "Well, what's wrong with me that I'm not falling pregnant?" And it wasn't until I got there that they said, "Oh, well, we need to test your husband for X, Y, and Z," and really started that process, and, he was very on board with that, and as he should be, but I also hear from, my peers that their partners aren't so receptive to putting in the work to increase the chances of falling pregnant, and it's quite frustrating, and you mentioned shame. There's a lot of shame around infertility, and I just wish we could kinda change that narrative. Are you seeing the narrative changing as you've been working? You said you've been working since 2009, which I don't know, I can't imagine it not changing, so I'd like for you to share a little bit about that with me.
Yeah, I do think it is changing, but it really depends on the personality of the couple. And so I always encourage couples when they come in to be talking to other people about it because it's so much more common than they really think that it is. And, there are some old school conservative type parents, especially that really can't wrap their head around fertility treatments. And so, of course, those couples are going to struggle with sharing with their family about that. But, as far as male factor goes, it's 30% female infertility, 30% male infertility, and 30% a combination of the two. And so we're really looking at a 50-50 split. But especially here in the United States, if it's male factor and the male has fertility coverage through his insurance, but it's the woman that's going through IVF, the insurance will not pay for those treatments, even if it's diagnosed male factor. So, it's always falling on the woman. And it doesn't matter what the diagnosis is, she's going to come in feeling like she can't fulfill her sole purpose, that she can't, biologically, we were meant to reproduce. We are the ultimate creatrixes on this planet. Every life comes through our uteri. And if you can't perform that function, it can really weigh on your soul. And so these women come in broken, no matter what the diagnosis is, no matter whose issue it is. And so I do think that the more that it gets talked about, there's more about it in social media, there's more about it in the news. I don't think it becomes any easier. I think the shame is still there, but at least they know that they're not the only ones that are going through this.
And it is very challenging. Like you said, many women are waiting until we're older. We were 37. Well, I was 37 before we decided to start trying. It is frustrating because you kind of have to choose, don't you? Do I, maybe potentially increase my chances by trying to fall pregnant younger, but I'm not ready yet and I want to finish school? Or do we wait and, hope that everything still works? And so you're waiting, and then all of a sudden you get to this point where you think, okay, we're ready. We're going to try and have a baby. And in my experience, if I could speak to my own personal experience, we were going to try, but we were also thinking, okay, if it doesn't really work, within the next 2 years, then we'll leave it, and that's okay with us. But then we started the journey, and IVF is a difficult journey. All of it I found quite challenging. I actually found the whole process of the appointments and the procedures and everything to do with all of that, the injections, I actually found that harder than my pregnancy. And I think a lot of it was the emotional strain that it had on me. And even though my husband and I went into this thinking, we're gonna give it our best shot, but we're also okay if we don't have children, that quickly changed to, "I really want this to work." With every injection, it was, "Please, let this work. Let this work." And it started to become, this emotional stress, like it was all-consuming, and perhaps that's not the experience that every woman has, but I did find that once we started the journey, it's all I thought about, and they say, "Well, relax, don't be stressed out, just let your body do its thing." That wasn't an option, and so I did start, I practice Reiki, and I'm very into the holistic realm. So I did start, self Reiki treatments. I went and saw my Reiki master for treatments, and I did eventually go see an acupuncturist as well. And I'm a big believer that, the whole of all of that really helped and boosted the IVF. So I want to know, when people walk through your door and, they're feeling probably a little deflated and wondering what to do next, what does that look like and how can you support those women and men?
Well, I think the first thing that's important for them to know is that they do have options. I think once you, like you said, once you get down, you start moving down that trajectory, it's like a snowball. It just keeps going. It's like, okay, we'll do 3 rounds of medicated cycles and then 3 rounds of IUI, and then you move on to IVF, and it's just like this protocol that they move you through. You don't have to do it that way. You can, and I will talk you through what your options are here, but you don't have to be pigeonholed in that way. I also want them to prep their bodies as best they can for that process, and that includes diet modifications, lifestyle adjustments, supplements. I refer out to a lot of different practitioners, whether that's a talk therapist or a body worker, or, we work through lifestyle aspects like what else are you creating in your life? If you're having trouble creating a child, what about art or cooking or gardening or something where you can channel that energy? And we talk through the emotions, and, acupuncture is so beautiful in that way. We can have a real heart to heart discussion for a half an hour, just like you're in with a therapist. And then I get to lay you down on the table and just kind of smooth out all the rough edges so that you feel better when you walk out instead of totally drained from hashing out all of your concerns. But, the experience of going through IVF for the vast majority of women is very traumatizing because they feel pretty disempowered. The doctor's like, you have to do X, Y, and Z at these specific times in this specific way. And there's just really no wiggle for autonomy and choice. And I think that that's really, really scary and hard for women. Never mind the side effects of the medications, which varies case by case. Some women don't really notice anything at all, and some women literally lose their minds during that whole process, all for a very high price and no guarantee it's gonna work. And so, there's so much that goes into it and so much to tease out, but the important part is, like, there is a lot that you can do to maximize your outcome, and you don't have to do exactly what your doctor says.
Yeah, and that's something that I think a lot of people need to learn. Our doctors are people too, and they make mistakes, and they're going by what their experience is and what they've learned. And you're walking in that door already feeling pretty vulnerable. So you're looking for someone to tell you what to do and have all the right answers, but you need to really consider all options and walk in there strong, which is not an easy thing to do when you're at this point. And, there's another episode where we talk about medical gaslighting, and it's far too common, and I feel as though some medical professionals may take advantage of people when they walk through the door and they're feeling vulnerable like this because it's so hard to stand up for yourself and it's so hard to understand. You're asking the question, why am I not pregnant yet? Why isn't this working? Why me? And when you have all of that weighing on your shoulders and then you have a doctor looking at you saying, just these insensitive comments in many cases, it can be even further deflating.
Absolutely. And I don't know how it is where you are, but the vast majority of reproductive endocrinologists in my area are men, which I find pretty frustrating. And, speaking of that vulnerability, not only are you feeling, like less of a woman, but the positions that they put you in to do these procedures are incredibly vulnerable. And then you're surrounded by men, often unconscious at that time. And so the whole thing is a really, really scary experience. But, you know, medical gaslighting is a thing, but I tend to think that the doctors really are doing their best and they have the best intentions. They just don't have a breadth of training. They have very focused, specialized training. And so they can only tell you what they know. And where I think that they really make the mistake is not taking into consideration what everybody else's training has been and what they know, and need to get better about referring instead of my way is the only way. We all know at this point with integrative medicine that the triage, pulling in multiple modalities is the way that we're going to get the best benefit. And I get a little frustrated when I feel like these doctors kind of play God, so to speak, and they don't pull in those resources that their patients absolutely need, because, like you said, they feel broken and vulnerable, and they need that buffer of autonomy and choice so that they can come through this a little less unscathed.
There's that element too, like you said, many of those doctors, particularly in the States, being male, they don't have an understanding. They've never been there, and whether or not they've seen their wife go through it or if they've gone through that process to have their own children, it is different when you're the woman and you're feeling those feelings and injecting those hormones and being the one, having all those procedures done. Like you said, the positions that you're in and conscious and unconscious, and the conversations that you have to have. It's very difficult for a man to really understand what that must be like.
I think things would be a lot different in in a lot of the different medical and political landscapes if the male was the patient.
And we could
Like,
talk
very
about that
different.
in many industries, not just medicine, right? Shelby, you mentioned to me before we hit record that you offer a course, and I'd love for you to share that with us and where we can find it.
Absolutely. And so over the course of, working with women for the past almost 2 decades, I have found that my reach here in Louisville, Kentucky of the United States is so limited, and I knew more people needed the information that I had to share. And so I spent about 2 years honestly building this course that is called Wild Rose Woman, and it's a 10-module holistic fertility course that covers everything that you need to know to take care of yourself, whether you're trying to get pregnant naturally or you're going through IVF or a combination of the two. It covers diet, lifestyle, self care, meditation, movement, supplements, anything and everything that could be causing your fertility struggle, from lifestyle factors to hormonal factors to physical factors and complex conditions such as endometriosis and PCOS and autoimmune infertility. We'll cover the basics of how to identify issues in your cycle. And then there's also a full module on all Western fertility treatments, interventions, and testing. And you can find that course on my website at commongroundlouisville.com.
Thank you. That sounds very comprehensive. And I'm actually thinking that there are certain modules in that may just benefit women who aren't necessarily trying to fall pregnant with the tracking your cycle. And what was it you said there about identifying some issues in your cycle? That's something I think that all women, right from teenagers up could benefit from because there's still some so limited research done on our menstrual cycles and how we navigate them for the many, many years that we have them.
Absolutely. And when I do telehealth fertility coaching and even in the treatment room with people, as I'm walking through the information and what's called cycle science, the module that's on how to track your cycle and identify issues, it is what we should have learned in health class in high school. But so many women, I mean, I'm literally talking to RNs, nurse practitioners, people that work in the healthcare system. They don't know it either. And so we're starting back at square one and of the things that we should have learned in health class instead of abstinence and fear mongering around STDs.
That's right, and I mentioned this to a friend recently, actually. I remember in sexual education pretty much being taught, like you said, abstinence and you will fall pregnant. You will fall pregnant, and it will happen right away, and it can happen the first time and the second time, and it'll happen over and over again, and then when we become in our 30s and we're trying to fall pregnant, it's like, "Well, that hasn't happened. Where's all this falling pregnant just thinking about it?" So a lot of misinformation and you're right, fear mongering around sex, which is really unfortunate.
It's really unfortunate.
Yeah, incredibly. I'm so happy to have you join me here today, Shelby, and I want everyone to know who's listening. I'll share the links that Shelby mentioned today and some more in the description of the episode. So go have a look at her website. Feel free to reach out, take one of those telehealth appointments, or send her an email. Thanks again, Shelby. It's been lovely.
Yeah, it's been great, Amy. I appreciate you having me.
Thanks for joining me on the Holistic Health Show and trusting me to guide you towards proactive healthcare. If you enjoyed the episode, don't forget to subscribe now on your favorite podcast platform and get ready to embark on an incredible journey toward holistic wellness. Until next time, be well and stay holistic.